Let's talk about your legs this morning. I don't mean your bathing suit legs, I mean your walking about legs and the health of them, because if you, as you begin to get older, begin to notice varicose veins, that could be not only a cosmetic issue for you, but an actual health issue as well. So we're very happy this morning to have James Gooden back on the show. He's with Milligan Vein Clinic, fairly newly opened, a location in Cleveland. So nice to see you.
Yeah, thanks for having me back.
I kind of stumbled my way into that open for you, but it is kind of true that we talk about kind of the vanity factor of how our legs primarily can look. But if you are dealing with varicose veins, that's a health problem.
It is, and there's misconceptions that what we do is mainly a cosmetic type of treatment, but that couldn't be further from the truth. The majority of the patients that we see in our office are coming to us with pain, with discomfort, with swollen, tired, crampy legs, and it's really putting a limit on their ability to have the quality of life that they deserve.
Is it a domino effect a little bit, James? If you have one varicose vein left untreated, will that then lead to others?
So yeah, it is a sort of progressive disease, and it may just start out as some spider veins or a noticeable sock ring in your ankle when you're, things are winding down at the end of the day.
Mm-hmm.
But over time, just the chronic inflammation from the disease process can cause permanent damage to the skin, to the legs.
Was I right or wrong when I made the comment about it being as we get older? But can varicose veins appear even when you're in your 40s and 50s?
They certainly can. And when we say varicose veins, we're not just strictly talking about the prototypical ropey veins that we see when we're out in public. A lot of these are deep under the skin. They're not visibly noticeable, but our patients sure feel them.
So sometimes you feel it before you see it.
Absolutely, and like I said before, it typically will present as just tired, heavy, swollen legs. May notice some restlessness at night, and that's just because the veins are inadequate. They've been irritated all day long, and as our day winds down, our veins are kind of letting us know.
When you say swollen, you mentioned the ankle. So is that where you're going to see the swelling, or could it be in your calf? Does it vary?
It can involve the entire leg, but as with most of the symptoms involved in this disease process, they tend to be more prominent from the knee down.
Okay, so I was asking you how y'all treat it, and once upon a time the treatment standard was surgery.
Sure.
You don't have to do that anymore.
Sure. Many years ago, the treatment of choice was something called a vein stripping, and it was a fairly morbid procedure and a big operation. If you heard anybody, or if you knew anyone that had it done, you probably didn't hear anything good about it.
Yeah.
Well, today using technology, minimally invasive techniques, we're able to achieve the same results and even better results with a 20-minute procedure done mainly through needle sticks using catheter-based surgery.
So if somebody came to you and maybe they had not been seeking attention soon enough and they've got maybe quite a number of varicose veins, would they come to you just the one time, or would it be repetitive for a little while?
Well, it is a process.
Okay.
And so patients will first come to see us in the office. They'll meet me, and or if they're in one of our other offices, they may meet me or John Milligan. We listen to our patient's story, taking note of all the symptoms they're having, do a thorough exam, and if it looks like vein disease and sounds like vein disease, then we proceed with a workup that is fairly uncomplicated. We do a venous ultrasound. We get those in the office. Pretty much all of your treatment from start to finish gets done in-house in one of our clinics. That venous ultrasound will give us a roadmap of your veins. Everybody sort of has the same veins, but they're not always laid out the same way. And certainly people present with different problems involving different veins. So we get a roadmap of your veins. What we're looking for is basically swollen veins that with flow in the wrong direction.
So they can come to you, get that conversation going. You're just up the road from us in Cleveland, so you don't have to go far at all. And then with a 20-minute procedure that you'll have as much as they direct you to, depending on your particular need. There's no surgery required, and you'll look and feel so much better.
Absolutely, you will.
So here's where you can reach them. It's Milligan Vein Clinics. The Knoxville location is their primary one, but we're going to give you that number knowing that they're going to be in Cleveland, which is the location that you'll want,
Yeah,
right?
We're in Cleveland presently.
If you are, however, a huge Tennessee fan, just go up a few days early for the game, and they'll be happy to see you in Knoxville if you want to. But milliganvein.com is the website. Thanks for the education this morning.
Again, thanks for having me.